Good day, everyone. I'm here to talk about pressure sores today. So what are pressure sores? Pressure sores are wounds or breaks in the skin which are a result of bony prominences or areas where we have a lot of pressure pressing on the soft tissue, meaning the skin and the fat underneath. Pressure sores oftentimes develop in individuals who are high risk for pressure sores. So why do pressure sores develop? Pressure sores develop because of a lot of things. It is oftentimes multifactorial. It can be because of state of a person's body. It can also be because of external environmental factors. But most often than not, the reason why we coined the term pressure sores is because these sores or wounds are a result of prolonged pressure or prolonged trauma to a particular place. Most oftentimes, these pressure sores are found in bony prominences. For example, the elbow. Prolonged pressure on the elbow can produce pressure sores. A more common area is what we call a sacral decubitus ulcer. Pressure sores on the back are results of the bony prominences such as the spine or the pelvis pressing against the skin and soft tissue for prolonged periods of time, which comes to the point that the blood flow to that particular area is compromised or is decreased. So when there is decreased blood flow to a particular area, pressure sores develop. Why do normal individuals not develop pressure sores? Because we have a negative feedback. We have a feedback mechanism in our mind, in our brain, which tells us to shift weight. For example, you're sleeping. That 6 to 8 hour interval, you unconsciously shift your weight because of the signal to your brain. The brain receives a signal from your body indicating that that particular part already has some pressure built up. So you're sleeping in a particular position and your body is already, there's already compromised blood flow. Your brain will signal your body to shift. And that's the reason why we shift in our sleep. For some individuals, mainly individuals with comorbidities such as patients who are chronically bedridden, they're already bedridden, they do not have this mechanism anymore. So they develop pressure sores. So the pressure sores are results of individual changes. For example, stroke patients, patients who are bedridden, patients who are paraplegic, are unable to walk. These are some of the subsets of patients which have a predisposition to develop pressure sores. Also, other subsets such as diabetes mellitus, connective tissue disease, and other problems can also lead to chronic wounds. Other problems which may aggravate the pressure sores. So these are the subsets of patients which we need to check regularly. I'm sure you know of a diabetic patient who has to check every day. When he or she comes home, check the soles of the feet so that make sure that there's no wounds there, because if they don't, then a small wound can progress to a big wound. Right? So those are the subset of patients which may develop these pressure sores. So what are the stages of pressure sores? We need to know the stages of pressure sores. We need to classify them and show you some pictures so that when you communicate with us, we are able to give you an appropriate management. What are stage 1 pressure sores? Stage 1 pressure sores are wounds, which are pale. When you look at the skin, it's pale. The usual skin is pinkish. In whitish individuals, it's pinkish. In darker skinned individuals, it's a bit blackish to bluish. So these are stage 1 pressure sores. when we say, I just want to introduce a term, it's blanchable. When you say blanchable, when you press a particular area and then release it, the pale area becomes pinkish. That's blanchable. Now, when that area becomes non-blanchable, it's not responding to when you push it like this and then you release, and it's still pale. It does not fill with pinkish color. Then that's non-blanchable. That's already a stage 1 pressure sore. Okay. Now, for stage 2 pressure sore, these usually, when you see blisters already, and you see the skin going off, being peeled off, that's already a stage 2. This is what we call a partial thickness wound. Now, when you go to stage 3, the stage 3 pressure sore is when there's a full thickness, meaning the whole length or the whole thickness of the skin is already removed. So that's a stage 3. Now, the last one, stage 4, is aside from the skin, it also has injury to the underlying tissue, meaning you already have some injury to the muscles, for instance, and that's already a stage 4. Okay, so at stage 1, you can already come to us for help, because if we do not address it at stage 1 and the insult or the injury continues, then it's bound to become a stage 2, and eventually a stage 3, and eventually a stage 4. We don't want to reach the stage 4 point, because it's going to be a lot of there's going to be a lot of problems associated with higher stage classifications. So as early as stage 1, you can already seek our help in the SWC or the Advanced Wound Care and Stomach Care Clinic, so that we can help stop the progression of the wound. So nowadays, because of our pandemic, because of the COVID-19 pandemic, wound care has drastically changed. And so, in order for us to help you, you have to come to us as early as possible. Because, for example, stage 1 pressure sore, we can space the follow-ups after your first consultation. We can space the follow-ups depending on the severity. Okay? So, if we catch it early, you don't have to come over every week or every day. So here in TMCSL, Medical City, South Luzon, the Stomach Wound Care Clinic aims to treat wounds, but not just wounds. We treat patients as an individual. So each patient is individualized. Each treatment is individualized per patient. And we do a multi-specialty approach, meaning we don't just treat the wounds, we treat everything with the patient. For example, a patient has diabetes, we have to treat the diabetes. If the patient has some vascular insufficiency or there's a problem with the vessels, we also have to treat that. Okay? So here in TMCSL, we look at everything in a patient. So even the nutrition, as well as other underlying factors, so that we are able to treat the wound properly. So if you know someone with a pressure sore, or if you yourself has a pressure sore, or you don't know if it's a pressure sore, go to us now at the Medical City, South Luzon, Advanced Wound Clinic and Stomach Care Clinic.